I'm Jessica Lee. I am a professor of neurology and the medical director for our comprehensive stroke program at UK Healthcare. Comprehensive Stroke Center is a designation from the Joint Commission, and it really designates the highest level of stroke care possible.
My name is Justin Fraser. I'm the Vice Chair of Neurosurgery here at UK. I'm also the Surgical Director of our Comprehensive Stroke Center, and I'm the Director of Cerebrovascular and Skull-Based Surgery here. Think of us as the buck stops with us, right? So we have to be prepared to take care of any kind of stroke patient, whether they're simple, complex, doesn't matter. We have to offer them the full gambit of imaging, of specialization, of rehabilitation services, of evaluations and surgical and interventional treatments. So really the buck stops with us.
There are many requirements that we have to meet, including things like 24/7 access to neurosurgery, 24/7 ICU level care for our stroke patients, 24/7 thrombectomy capability. We offer research opportunities. That is another requirement within the Comprehensive Stroke Program, and they also focus a lot on education. And then there are a lot of metrics that we have to meet related to quality and safety and the kind of care that we provide, and we report those back to the Joint Commission through a database called Get With The Guidelines. So the Comprehensive Stroke Center is really there as an overall or overarching approach to the total care of the stroke patient. And stroke comes in many forms. We think about the most common being the ischemic stroke, or where there's a blood clot or a blockage of an artery that's supplying blood flow to the brain. But you can also have bleeding types of stroke or aneurysm. It really is a very holistic, comprehensive approach in the stroke program.
Now that doesn't mean that every stroke patient belongs in our hospital. In many ways, we spent a lot of time and resources generating and building our network, working with outside hospitals, working with hospitals throughout the Bluegrass to develop their own stroke programs. Because in many cases, most patients can stay at a primary stroke center. That's an ideal scenario in our state where everyone is very spread out. And oftentimes, patients don't want to leave their community to come to the hospital. And so we really try to reserve our inpatient treatments for those who really need them, and spend a lot of time working with our primary stroke center partners throughout the state and really elevate their care as well to make sure that every patient is being treated to the utmost quality.
So that comprehensive center is there, again, to manage that critically ill, so patients with either large blood vessel blockages that we need to go in with a catheter and remove those clots, or they need very high level critical care monitoring. And that can be for a variety of reasons. It may be because of their stroke, the size of the stroke causes swelling. So you experience swelling in the brain, and that has to be managed in a very specific way. So we have our team of neurointensivists who that's what they do, in partnership with the stroke team who's managing the other aspects of care.
A few years ago, we brought on board an app, if you will, called the Viz AI app. And this is literally an app on my phone. But essentially what it is if we're currently partnered with over 25 hospitals throughout the Bluegrass. If a stroke patient comes into any one of those hospitals and is given a CT angiogram, that set of images pops up on my phone. It pops up on my partner's phone. It pops up on the neurologist's phone. And we actually can converse and message each other and have a whole conversation over a HIPAA-protected texting app. And that allows us to make decisions and essentially bring our Comprehensive Stroke Center to the bedside, whether it's at our hospital or out down in Lake Cumberland or in Pikeville or in Frankfurt. Virtually, if you will, come to the bedside and make a treatment decision about that patient. It helps us to support those hospitals, to help them feel comfortable keeping the patients that don't need to come to us, knowing that we're just seconds away.
Because we try to practice that high-level care every day and we have standardized protocols, we approach every patient in the same way. That doesn't mean that we don't individualize care, but at least when you enter our doors, the system or process is going to work the same each and every time, which means we can deliver care quickly and deliver the right care at the right time. But our care doesn't stop in the emergency room because we have a dedicated stroke unit We have a dedicated stroke ICU. Teamwork is very important to us. So the care of the patient also doesn't stop when they go home. If they go home, we have something called the Transitions of Care Clinic, where a couple of our nurse practitioners will call that patient or family within a couple of days. They're going to see them within 2 weeks. For our patients who go to rehab, and we have some wonderful relationships with a variety of rehab centers around the region, for that patient who goes to rehab, we're also going to make sure that they have follow-up in our stroke clinic. So that stroke clinic is not just your primary care doctor or a general neurologist, but you see a stroke specialist. So we know that A, we've done everything that we needed to do within the hospital stay. B, once you leave our hospital facility, you're receiving the appropriate rehabilitation that you need. And C, when you come to us for follow-up, we're going to check off all those boxes again and make sure you have the resources and the things that you need to return to the best level of activity that you can, hopefully back to a normal life.